Good morning, everyone. Thank you so much for joining us this morning for our final deep dive for the new Blue Shield of California Medicare Advantage PPO plan. We're really excited to have you here. We're going to share a short pre-recorded message. We do want to make sure we answer everyone's questions. So if you can open your chat and type in your questions there. We do have a representative from Blue Shield named Charles Lee, who is ready to answer your questions today. And with that, I am going to start sharing the video. Sorry, having a little technical difficulty.
Would you like to start on my end, Jessica?
Yeah. If you have it ready, please.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025. Open enrollment starts at 8 a.m. Pacific time on Monday, September 30th, 2024, and ends at 5 p.m. Pacific time on Friday, October 25th, 2024. You may enroll through the e-benefits portal on the San Francisco Employee Portal. Paper applications must be postmarked by October 25th, 2024 to be accepted. During the webinar, all attendees will be muted and off camera for the entirety of the presentation. We encourage you to ask questions at any point during these presentations. To ask a question, open a chat box by clicking on the chat icon in your menu bar. You may find the menu bar either at the top or bottom of the screen, depending on whether you are using a computer, a mobile device, or a tablet. We will answer as many questions as time allows during the Q&A portion of the presentation. Important. Please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SF-HSS members, which can be found at sfhss.org/OE2025. If you have eligibility questions, please call SF-HSS Member Services at area code 628-652-4700 or visit our offices at 1145 Market Street, 3rd floor, during our business hours listed on the screen for further assistance. And lastly, we want to remind everybody to get their annual flu shot and COVID booster to protect yourself and your loved ones during this fall and winter. And with that, our presentation will now begin.
Thank you for joining the SFHSS Blue Shield Medicare PPO webinar. We look forward to help support you and your loved ones when it comes to your health and well-being. In this short presentation, we are going to cover what Blue Shield Medicare is and how it works. We will also share information on transition of care from United Healthcare to Blue Shield of California. Blue Shield Medicare offers comprehensive medical and Part D prescription drug coverage with the freedom and flexibility to access care from in-network and out-of-network providers nationwide. This plan may be a good fit if you like to self-refer to specialists and see both in-network and out-of-network providers. Plan highlights to take note of are no to low co-payment for most Medicare covered services, access to virtual health care with Teladoc doctors, and coverage for medical care across the United States, including urgent and emergency care anywhere in the world. Blue Shield Medicare gives you flexibility and choice. You can choose to receive care from Blue Shield Medicare in-network providers. This option allows you to pay your coverage copay, and the provider will bill us directly for covered services. Or, you can choose to receive care from out-of-network providers that participate in Medicare and are willing to treat you. Here are some helpful tips before seeking care from out-of-network providers. Check with your provider before receiving services to confirm that they participate in Medicare. If you receive care from a provider who does not participate in Medicare, you will be responsible for the full cost of the services you receive. You don't need to get a referral or prior authorization when you get care from out-of-network providers. However, before getting services from out-of-network providers, confirm that the services you are getting are covered and are medically necessary. It is best to ask an out-of-network provider to bill the plan first. But if you have already paid for the covered services, we will reimburse you for our share of the cost of covered services. Or if an out-of-network provider sends you a bill that you think we should pay, you can send it to us for payment. As you can see on this chart, your Blue Shield Medicare plan gives you the flexibility and choice to not only see in-network doctors and healthcare providers, but also out-of-network doctors and providers at the same cost share as long as they participate in Medicare and bill Blue Shield of California. There are no deductibles and no to low co-payments for most covered services. Coverage includes a $0 co-payment for routine hearing exams and a $2,500 allowance per ear every 3 years for the purchase of hearing aids. Blue Shield Medicare gives you access to pharmacies that offer preferred cost sharing across the United States. Major pharmacy locations include Albertsons, Costco. A member doesn't need to be a Costco member in order to obtain covered prescriptions here. CVS Pharmacy at Target, Safeway, Vons, and Walmart, where you can receive a 3-month supply for 2 months' worth of copay for most drugs. You may also have your maintenance medication delivered to your home or office at no charge for shipping. Signing up for home delivery pharmacy saves you a copay. Receive a 100-day supply for the cost of a 2-month supply of covered maintenance medication. To find a network pharmacy near you or more information on formularies and home delivery prescriptions, visit our website at blueshieldca.com/sfhss. Blue Shield Medicare provides coverage for routine acupuncture and chiropractic care at a $15 copay per visit, for up to 24 visits per benefit category per calendar year. These are non-Medicare covered services. No need to see your physician of choice for access. You can self-refer to any chiropractor and acupuncturist in the American Specialty Health Plans of California ASH network. To find an acupuncture or chiropractor provider, go to blueshieldca.com/find-a-doctor. For out-of-state acupuncture or chiropractic services, call Blue Shield Medicare's dedicated customer service team for assistance. Your Blue Shield Medicare membership comes with additional benefits: vision coverage, transportation for non-emergency medical appointments, personal emergency response systems that keep you connected to your caregiver network, gym membership with the Silver Sneakers fitness program, and a home meal delivery service to help with your recovery after being discharged from inpatient hospital or skilled nursing facility care. To find out more about the benefits, visit our website at blueshieldca.com/sfhss. Getting answers to your urgent questions has never been easier. The Blue Shield Medicare SFHS website gives you 24/7 access to health plan information. With only a few clicks, you can get an overview of your Blue Shield Medicare plan. Find in-network doctors. Download plan documents. and get details on some of the benefits like emergency and urgent care around the world, preventive care coverage, 24/7 virtual care with Teladoc, and so much more. To ensure a smooth transition of care, members will have direct access to Blue Shield Medicare's dedicated customer service team to answer any questions members may have regarding the plan. Additionally, the highly skilled Care Navigator team is here to help with scheduling appointments and care coordination. Members receive dedicated support from the pharmacy technicians on any pharmacy or formulary questions. Blue Shield's pharmacy implementation team is working closely with SFHSS and Optum Rx to help ensure a seamless transition. To help ensure continuous medication access, existing open refills for home delivery and specialty pharmacies will be transferred with member enrollment. Members will have access to a concierge team with pharmacy benefit specialists to help answer inquiries about the Blue Shield pharmacy benefit and network. And lastly, Blue Shield is disseminating proactive communications with educational materials help facilitate formulary transition and mitigate disruption. In addition to medical and pharmacy benefits, Blue Shield Medicare members have access to behavioral and physical health benefits. Call Blue Shield's highly trained Medicare customer service team to receive help with questions about behavioral health benefits. As mentioned earlier, your Blue Shield Medicare membership comes with the Silver Sneakers benefit, which includes a gym membership, community classes, and online programs to help with your overall well-being. We know you have many choices, and we appreciate you investing this time with us. To learn more about the Blue Shield Medicare plan, visit our website, blueshieldca.com/SFHSS. Thank you.
Okay, thank you, everyone. And I see in our chat that we already have several questions from our members. So I'm just going to read them out loud, even though I know our representatives have already been answering them. I'm just reading them out loud for the video that we're going to get posted later today. So the first one from Susan Goldstein, I'm on Medicare plan. I have a dependent who lives out of state. Which Blue Shield plan would he be on? The non-Medicare PPO? And Olga, I think you answered this one.
Sorry. Yes. So for hi, good morning. For out of state dependents, they will have full access under the Blue Shield PPO plan. I know there was a couple of follow-up questions from the same member as well. If you originally had your dependent enrolled in UHC Select EPO plan, which was a limited scope plan as well and is limited to the state of California, they would have had emergency services only with that plan. And so in order for them to have full coverage, it would be the PPO plan outside of California. And dependents who turn 26, we do provide notice for you that they will be before they are terminated, and we do switch any members who have a terminated dependent to whatever the appropriate plan is for them, whether it's member only or if you have other dependents on there, they'll continue on coverage while the aged out dependent will have their coverage terminated. And we also provide you with COBRA information for them if they choose to enroll.
Perfect, thank you. And I think you answered her next question, which was about the life event and going into a member-only coverage. So, and so I assume I need to go and change that. It's not a passive change. Okay, I see what you're saying. So Olga, you answered the three questions, including for the out-of-state dependent, the form she received was for Access Plus HMO. So in order for her dependent to have access to medical coverage beyond emergency, they'll have to change to the PPO plan instead of the Access Plus HMO.
Correct.
And then I've got Rosemary, I was on United. It looks like I will automatically be put into the new Blue Shield plan, which is correct. There's no action needed for the transition. And Tara asked, does it provide helicopter coverage? Charles?
Yes. So, yes, this plan does cover whatever emergency transportation you need, just as original Medicare would. Yes.
Hi, Jessica. This is Holly. I'm just noticing that there are some folks on the line who are raising their hand, but we want to encourage everyone to write their questions in the chat. Is that right?
Yes, that's correct. Unfortunately, we can't unmute you. So please go into the chat. The chat box looks like a little bubble. It says the word chat underneath it. And we will, so I see Irene, your hands up. We will get to your questions in the chat.
Thanks, Jessica.
Claire asked, can you please write the phone number and URL to request individual appointment? Charles, can you provide that 800 number?
Yes, it's 800-370-8852. And once again, that's 800-370-8852. And folks are available 7 days a week, 8 to 8 Pacific time, to talk to you and answer your questions about the plans and any other information you would need.
Yeah, and can you clarify for Tara's helicopter coverage? If she's climbing Mount Everest, are you going to provide helicopter coverage to get her off the mountain?
Yes, so it's very limited in terms of usually if you're not on a mountain, you're going to be defaulted to an ambulance coverage. But as needed, correct. If you are out of the country and in a certain area, that is how we need to get you to safety. Absolutely, it is covered. So.
Okay, and then Charles did put the 800 number in there. And
Yes.
And then Gail asked, no Walgreens for prescriptions?
Walgreens is actually part of our network, so we're good there.
And then Marley wants to know, when will we get our new medical Blue Shield medical cards?
That's a great question. So we're processing the enrollment files in early December, and so you should receive the ID cards and the welcome kit in middle of December. So if you
Great.
don't, and so let me just add, if you don't, do us a favor and give us a call. After that period, give us a couple days after the 15th, let's say the 20th. And we can check in on the status of that or provide you any member information. You can also, after the middle of the month, a little trick is if you call us and we're able to give you your member ID, you can actually use that information to log online through the portal and get set up that way, and you'll have a digital ID card possibly before your physical one. So a little trick that you can, contact us. We'll give you the information for 1/1, and you can get a jump on it. You can log on before 1/1.
Great. And then Susan asked, I chose Cobra on my dental when I retired. That ends at the end of this year at 12/31. If I want to have Delta dental coverage, do I sign up now to go into effect January 2025? Oh, Olga?
Sure. So there are two different options based on the timing in the scenario provided. One, you can enroll during open enrollment, and your benefits will start January 1st, 2025. At this point, you will not need any termination of coverage documentation to provide to us in order to enroll. However, if you wait until your COBRA coverage ends, you will be required to provide termination documents from the COBRA plan in order to enroll into the coverage, and that will have to be provided within 30 days of the end of the coverage. So it makes it a little administratively on your end, it makes it a little bit smoother to apply during open enrollment.
Great, and Friday is the last day, so please get those enrollments in. And Tara asked, when I change to Medicare next year, can I switch to Blue Shield in May 2025? And my husband on my plan is not ready for Medicare. Can he be on BSE, although not in Medicare? I think this is an Olga question.
So assuming that you are currently as a retiree in a non-Medicare Blue Shield plan, you will be switched over to the Medicare Blue Shield plan at the time that you turn 65, you will have a requirement to enroll in Medicare, of course, and provide verification of your Medicare enrollment to us in order to avoid being placed into the penalty plan. So we want to make sure that you're getting the full Medicare Advantage plan with with Blue Shield. Your spouse who is under 65 will be enrolled in whatever plan they were enrolled in with Blue Shield, assuming again that you're currently enrolled as a non-Medicare retiree. And they will continue with that coverage until they are required to enroll in Medicare, and that will be when they turn 65.
Thank you. And next question, Susan, it's a great question. And this one's for you, Charles. Do I need to get pre-approval from my primary care doctor before I see a specialist, or can I go directly to a specialist with this PPO plan? Same question about a not in-network doctor.
Correct. So, yes, you can go directly to your specialist without going through a typical gatekeeper as with an HMO plan. So, let's say, for example, I like to use like a dermatologist as a good example, or a podiatrist is another example. You know that your foot is sprained, or you've got a skin issue you want to take care of. So, those are absolutely positive that you can go directly as with any PPO plan. Secondarily, in and out of network. So in network, I'll just take a couple seconds here. In network means that these are Blue Shield contracted providers in the state of California. And also we've got in-network providers through our Blue Shield, Blue Cross Blue Shield network nationwide as well. So those are in-network providers. Out-of-network providers are providers that are Medicare participating. They participate in the Medicare program, but they don't have any contracts with us. So though in those cases, when you've got those non-contracted Medicare participating providers, as long as they understand the plan, they're Medicare participating and they bill Blue Shield. So Medicare participating and they bill Blue Shield, your services will be covered. And so you can always give us a call if you have any questions. We can also do an outreach to providers and educate them on the plan. And usually that's all that it takes to have out-of-network providers, accept current members. So hopefully that helps.
Thank you, Charles. And Claire has a question. I think it's also for you. The video went so fast. We're sorry, we know. I was not asking about concierge. I want to know where to go or call for a list of benefits, etc. So, Charles, I know you provided the phone number in the chat. Could you also provide the web address to Claire?
Of course.
Which is the blueshieldca.com/SFHSS. From there, you want to choose the Medicare plan, and for retirees, and you'll see once you get there that there's a section for, what is it, the evidence of coverage, the EOC.
Correct. Right.
And that will have the detailed list, but Charles is going to provide the actual link.
I put the link out there for the general, for everyone to see. And you're right, Jessica. You can get all your plan information, your plan documents directly there. Or once again, you can give us a call if you want to be a little social and chat with us. 800-370-8852, 8 to 8 Pacific time. And we can certainly answer specific questions about, particular benefits, pharmacy, drugs, formulary questions, any questions like that, we can address directly as well. I think, and then we want to also highlight to folks, that the member services is dedicated specifically to HSS, so you will not have a long hold time. We, on average right now, we've got about 8-9 seconds to be able to just wait in queue, and then we'll talk to you, help you with your questions. We are also not timed, so we are going to take our time and address our questions. If it takes 10 minutes, 15 minutes, 20 minutes, we're there to help you with the transition and take as long as necessary to make sure you've got the information you needed. So just rest assured, you'll be able to talk to us quickly, and then we'll be with you as long as needed. So for your questions. So.
Great. And Paula has a question. I think this one's for you, Olga. Can you drop your dependent if they're getting their own insurance? Also, can we get a dependent back on?
Yes. So a dependent can be dropped if they are getting their own insurance, and outside of open enrollment, you can do that as a retiree. Because I know it seems like there's actually a mix of folks here, employees and retirees on this call. So if you are a retiree, you can drop your dependent from medical at any time. You cannot add them until the next open enrollment or having a qualifying life event. For active employees, you can only drop your dependents during open enrollment or with a qualifying life event. And so, if you have a dependent who is gaining their own coverage, you can drop them with providing us with documentation of their new coverage, and we will be able to drop them. And that has to be done within 30 days. If you're an active employee, for retirees, you can drop them at any time. And then, if you'd like to add your dependent back on, as long as they continue to be eligible, you will be able to do that without additional loss of coverage documentation during open enrollment, but you will need that a qualifying life event in order to add them if it's outside of the open enrollment time period.
Thank you, Olga. And Rosemary has a question for you, Charles. I haven't checked yet, but what is the difference between in-network or out-of-network doctors so long as they both take Medicare Advantage plans?
That's a great question. So, in-network doctors I think for ease, administration is easier. The agreement and the understanding, they'll take folks right away. The out-of-network doctors, those are the ones that may need a little bit more education. And so those doctors are some doctors that we may need to do an outreach and help them understand that even without a contract, I think the key thing for out of network doctors is to share with them, even without a contract, this Blue Shield plan will reimburse providers 100% fee for service. In other words, we let doctors know, we let non-network doctors, non-contracted doctors know that we will pay them the same as Medicare. They don't have to worry about the amount of payment. And as long as they're Medicare participating and they bill Blue Shield, we're going to pay them as they would receive under original Medicare. And usually, as I said before, that's all that it takes for them to understand that, hey, we're not trying to, pay them 98% of Medicare rates, 95%, et cetera, et cetera. We're going to pay them 100% without a contract. And usually, providers are happy with that, happy to hear that, relieved to hear that actually, and they'll continue to see their patients.
Great, thank you, Charles. And it looks like Paula and Claire have similar questions.
Okay.
They're asking about out-of-state coverage in general
Right.
and how that works for retirees who, out of California coverage is the same as retirees who live in California.
Oh, that's a great question. So I guess from two aspects of it. So benefit-wise, I guess we haven't addressed benefit-wise. So benefit-wise, that's another great feature of this plan. We've worked really hard with HSS to make sure you've got the best coverage available as you deserve. So you don't have to worry about, hey, is this provider in network or out of network? As you briefly saw in the video, unfortunately, the benefits are exactly the same. So whether you go to a doctor that's in network or out of network, it's a $5 copay. And a specialist, it's $15 in network or out of network. So you don't have to worry about the in or out of network aspect from a benefit standpoint. Now, from an access standpoint, we do have, as I mentioned, Blue Cross Blue Shield brother sister plans nationwide. But even outside of that nationwide in-network Blue Cross Blue Shield providers, once again, you can use any Medicare participating provider. And even if they're technically out of network, as long as they understand that they, Medicare participating and then bill Blue Shield, they can continue to see you, and you'll have the same cost share, $5, $15, or whatever the procedure is, your service is out of network as well. And that's nationwide. So I said a lot there, and hopefully that we can continue to reinforce that.
Great, thank you. And then Irene is asking, is Blue Shield our primary and Medicare our secondary?
That's a great question too. So technically, with this plan, Blue Shield becomes primary, and so we take care of all the claims, all the services, and Medicare actually steps out. So Medicare is not even secondary. Blue Shield is your primary provider here. So.
Right, and Eloida has a question regarding pharmacy. So
Okay.
I order at Optum Specialty for an injection drug. It's very expensive with minimum copay $10. Would that be the same with Blue Shield?
Uh, Generally, yes. So we've got the same benefit and the same pharmacy designs and the same formulary. But just to double check and make sure for your specific instance, I would recommend that you call in at 800-370-8852 and get that confirmation though. So we've worked very diligently to ensure as least disruption as possible, including the pharmacy, including the formularies, and including the benefits. But I would suggest that you give us a call, 800-370-8852 to confirm that. So.
Okay, and then our next question comes from Chi Ting. Can I know which general preventative labs? I was on UHC and did a lipid panel, but I got charged for the lipid panel charge. That might be something you want to talk to a member service.
Right. I
The
think
concierge.
to get better detail about the specific types of testing, including lipid and other special indicators, I think calling into member service 800-370-8852, you'd get better clarification to what are the preventative tests and what do they include or not include sometimes. So.
Great. And Jingdai asks, what advice would you have for a new enrollee in the Blue Shield Medicare plan who would be switching from the Kaiser Medicare Senior Advantage plan?
Oh, I guess from a coverage standpoint, you've got the same coverage or for the same types of procedures and tests and medical care you need. But from a Blue Shield perspective, you've got that additional flexibility. You've got that flexibility not only within California, you've got that nationwide flexibility as well. So if you do 6 months in California and then you do 3 months in Texas and then 3 months in Florida, all those services with Blue Shield will be covered. And so you've got that flexibility to go in and out of network as needed, see specialists as needed, as long as they're Medicare participating one and two bill Blue Shield, you will be covered. So that Blue Shield basically gives you additional flexibility as you need.
Thank you, Charles. But I think when she's talking about
Oh, okay.
transitioning,
Oh, okay.
it would be best to establish yourself, find a doctor.
All right.
So
Yes,
can Blue Shield help
absolutely.
find a doctor? And
Absolutely.
then what
Yes.
about transition of medical file from Kaiser to Blue
Right.
Shield?
So absolutely. So sorry about that, Jessica. Thanks for that redirect there. So absolutely. You can give us a call once again, 800-370-8852. What we can do is we can work with you to understand your needs and preferences, general practitioner, gerontologist, what type of internal medicine, what type of provider you want to use as kind of your point of contact, your primary care. We can help you locate that, and depending on the provider group and location, et cetera, we can help you focus in there and get you set up. And once that's set up, we can also give a call out to the provider and make sure that they've got your Kaiser information to be able to transition over, and so that you've got a smooth experience once you start with that new provider. So I appreciate that redirect, Jessica. Thank you.
Thank you. Yeah, make sure you have Blue Shield help you find a new doctor and get all
Right.
of your medical records transitioned over so that the new doctor knows
Right.
how to help you best.
Absolutely. And I think that'd be a great opportunity when you start at the beginning of the year to actually do an annual wellness visit. I think that would be actually a great first, introduction with them. And that'd be a great way to start off the new year, to kind of get an initial checkup and get all your tests and all your coverage kind of lined up and throughout the year, and to be able to take care of it and be healthy. So.
Great. And Tara has a follow-up about the helicopter. Will it
Okay.
bring to my doctor in SF? How far will this helicopter go? Well, we don't know where your starting point is.
I think, yeah, I think, Jessica, the main point is the helicopter service will probably bring you to the nearest provider to get you stabilized at least. Unfortunately, let's say if you're in Texas, it's not going to fly all the way back here to San Francisco, obviously. But I think the main thing for emergency services is to get you stabilized. And then once you're stabilized, we will obviously want to make sure you get home and then get the appropriate treatment to get you back up and going too. So
And then Claire's asking, is Walmart the only pharmacy that provides 3 month supply of meds
no.
for a 2 month
Yeah.
price?
Yeah, I think I put in there, there's also other preferred pharmacies. So the preferred pharmacies are the pharmacies that have that 2 copay for 3 months. And that includes Costco, CVS, and Albertsons, for example, as additional pharmacies that you can get that 2 for 3 coverage.
Great. And Jane has a follow-up. How can they transfer all of the medical record from Kaiser to Blue Shield?
Yeah, they do that almost on a daily basis, to and from. So the providers are going to be very familiar with the process. As long as you give your permission and give your vital information to be able to transfer back and forth, they are able to share information, to and from Kaiser to other providers. They do that on a regular basis, so there should be no issues with that. So just be reassured.
Great. And Tim has a question for Olga. Oh, sorry. Claudia has a question. Do we have to re-register in January at the Blue Shield website? Maybe she has a non-Medicare plan now. If they go from non-Medicare to Medicare, do they have to re-register?
Yes. So if you go from a non-Medicare to a Medicare plan, you'll get new ID cards. And I think that those ID cards with the member information does change. So you will have to re-register through the portal to get that information or that access updated. So correct.
Thank you. And then Tim has a question. I think this one's for Olga. Do I need to enroll in Blue Shield this October, even though I won't turn 65 until July? Also, what coverages if I live outside of the United States?
So, if you are not turning 65, you can continue until the middle of next plan year. You can continue with your current non-Medicare available plans. You can make changes to those, and the ones that you'll have available to you would be, depending on your location, a Health Net Canopy Care, the variety of Blue Shield HMOs, Access Plus and Trio, and the Blue Shield PPO plan. You'll also have Kaiser, depending on your location as well. So, but it sounds like you may be out of state. If you are out of state, the Blue Shield PPO plan is non-Medicare PPO plan is the only one that you have available right now, even as a non-Medicare retiree. Once you become Medicare eligible, you will transition to the Blue Shield Medicare MAPD PPO plan. You will be required to provide us with verification of your Medicare coverage, and we'll be contacting you 30 and 90 days before you're required to transition to that new plan. And we'll be doing that transition for you automatically. And if you do not comply with the Medicare element or providing us with the Medicare information, we will unfortunately be putting you into our penalty plan. So you want to avoid that. So make sure that you are applying for Medicare timely with Social Security Administration. We know that they can take quite some time to make sure that your enrollment goes through. So do that at least 90 days prior to your 65th birthday. And in terms of out of state or out of country coverage, again, not knowing what plan you're enrolled with now, but assuming that you're with the Blue Shield PPO plan now as a non-Medicare retiree, out of state, you'll have the same coverage. Outside of California, you'll have the same coverage. And I believe for the for out of country, you will be able to seek reimbursement. You'll have to pay upfront, but we'll be able to seek reimbursement from Blue Shield for the services rendered.
And if you decide to live outside of the United States, the Medicare benefits would not apply.
That's correct. So actually, thanks, Jessica. So if your permanent residence is outside of the United States, you're not required to apply for Medicare. So that is just a little bit of a difference between those who are residing in the United States and those who are out.
And just to clarify, Jessica and Olga, so if you're on the MAPD, Blue Shield MAPD plan, and you travel out of the country, the only services that are reimbursable are the urgent and emergency care
Thank you
services
for throwing that
outside.
in.
Yeah, so.
Thank you.
Thank you. And this is an Access Plus question, which is outside of Charles's area of
Domain, right?
expertise.
Yes.
You are welcome. I believe we spoke with our Blue Shield representatives, and they opened up new one-on-one consultations. Olga, would you mind putting that link in the
Yes,
in
I'll
the
put that
chat?
link in the chat. Yeah, absolutely.
Yeah, so there are new one-on-one consultations available. IVF is covered at 50%. And I believe you have to go through your OBGYN. And so we took Cobra in July 24. When does it end? I guess this is in regards to dental plan.
So for COBRA information, you're going to want to review the initial paperwork that was sent to you. There's different timelines that could be available to you, so depending on your situation. Also, our administrator for COBRA is PNA Group. Their direct customer service will be able to provide that information since we don't directly administer COBRA plans.
And then we have a question from a member. If you have Delta Dental, do you have additional dental coverage with Blue Shield? No, we don't have any dental plans with Blue Shield.
Medicare covered dental, Jessica, is covered, but it's limited. For example, I use for example, if you go to your grandson's baseball game and unfortunately you weren't paying attention, you get hit with a softball. Hopefully, that type of Medicare coverage will be covered. But you're correct. Routine dental coverage is not available through the Blue Shield PPO plan.
Okay, so emergency dental.
Yeah, emergency dental in terms of something, yeah, that like that. Yes, correct. Not routine, no cleanings, no fillings, etc. Correct. So.
And then Claudia wants to know, how's the process for worldwide coverage?
Great question. So urgent and emergency coverage is available through this Blue Shield PPO plan. So just make sure you get the necessary attention and medical help that you need. Afterwards, you can get the receipt. You need to pay up front, but you need to keep the receipts from those services. You bring them back home and you can submit them back home for reimbursement.
Thank you. And Margaret has a question regarding the fitness locations.
Okay.
Could you share the difference between the UHC and Blue Shield fitness program?
Right. And so I will take a second here. I'll get the Silver Sneakers is our gym membership program that we have for HSS members in 25. Just of note, that is also Silver Sneakers is also the same program United was going to shift to in 25 as well. So we would have been on the same network with Silver Sneakers in 25. I'll look that up in a second and give you the link to be able to take a look at what gyms are available. I understand that HSS has particular gyms that have been of interest, and we've shared those. Particularly, I think YMCA in the city is one popular one, and so we've shared that interest with our Silver Sneakers folks, and so they are continuously working on expanding their network. And so the YMCA gyms, for example, are gyms we've provided them feedback. Keep chatting with us, I guess, and letting us know your preferences. We can share that with Silver Sneakers and work on expanding coverage. So,
thank you. And Linda wants to know, they're out of the country in December and January. Do I have to call to get my Blue Shield number so I can utilize services?
Okay, so let me think about this for a second. So if you're out of the country in December, like I mentioned, what you can do is you can always call in, and after the middle of December, we should have you loaded in our system. You can call us in the middle of December, a little bit after the middle of December. We'll have your information. We can give you the member info, and then you should be able to log on with that member information and get your ID card virtually, and then you will be set for post 1/1. Okay, and internationally, once again, is urgent and emergency care. Before 1/1, you'll still be covered under your current plan with UHC. So,
Will they be able, if they download the Blue Shield app, is the Medicare side, will they be able to get like a virtual card if they have the Blue Shield
yes,
app?
exactly. So if you use either, you can log onto your portal online to your computer, or download the app also on your phone, which is more, I guess, Jessica, that sounds more realistic. If you do that, get the member info, sign or log on through your app online. That will get you a virtual ID card as well. So you don't have to be home, sitting waiting for the post office to deliver the ID cards in December. So.
Thank you. And Ying has a question. This is for Olga. It's regarding Delta Dental PPO. If you're both city employees, you cannot claim each other as dependents, so you cannot have dual coverage.
That's correct. And it's actually applicable to all of our coverages. So if we do have um, two city employees trying to cover each other's medical, dental, vision, they won't be able to do that. There's not an opportunity to be a dependent and a member at the same time. And that also applies to retirees.
And Jing wants to know how to get a second or third opinion for a service. So I think this was a transition from Kaiser.
Oh, this is a transition from Kaiser?
This is a follow-up.
Okay. Yes, absolutely. Second and third opinions are always available as needed with the Blue Shield plan, even if it's Blue Shield to Blue Shield doctor too as well. So, and then certainly with Kaiser to Blue Shield as well. If you've got a procedure or a specific question, obviously you can go and pay your typical copays and get that second or third opinion as needed. So, absolutely.
Yeah, and please reach out to the Blue Shield representative to help you locate a doctor or specialist.
Oh yeah, absolutely too as well. Yes, especially if you're changing from the Kaiser system to the Blue Shield side, we can certainly help you locate a specific practice or specific specialist, I guess, to help you.
Thank you. And we have another dental question, Olga. So we are in Texas. Can we get Delta Care USA DHMO or United Healthcare Dental DHMO? We have Delta Dental PPO currently.
No, so the DHMO plans are only available in the state of California. So your only option would be the PPO plan.
Thank you. And then we have a member who's retiring this December. Congratulations, incurring caring one dependent. Do I have to do an open enrollment by 10/25 or just do the SFHSS form with SPRS package in my November appointment?
I'll take that one too. So, because of your timing, whatever you would be electing right now during open enrollment will be a reflection of your active employee benefits. And so, if your retirement date is in December prior to the beginning of the next plan year for January 1st, you actually will have your elections, there will be an override of what you're requesting as an active employee. So what you're going to want to do is make sure that when you're meeting with us to enroll in your retiree benefits, you are providing us with the paperwork from SFRS, the application that's applicable to you, whether you're 60, whether you have dependents who are on Medicare or not. So the application for health benefits as a retiree, and then also if you do have dependents or you yourself are 65 plus, you want to make sure that you're providing us with your Medicare information. And so we will enroll you in your selected retiree plan as of the date of your retirement. there may be some, you just want to make sure that in terms of providing us the information, you provide that to us as soon as you receive FERS information and SSA information. And you do make sure that you're applying for Social Security if you are of that age or any of your dependents are, as early as now, so that they can get that processing done for you.
Thank you, Olga. And Claire asked, will we have access to a recording of the session? Yes, I'm going to try to get that posted later today, but also on our open enrollment calendar of events. So we're already 2 other Blue Shield deep dives, and those videos are already posted as well. And I've got another question. My open enrollment form switches my family, me and my spouse, on Medicare and dependent out of state son to Blue Shield MAPPO. Do we have other choices? Olga, I think this is a question for you.
I'm sorry, I was just doing a little research on one of the other questions. I'm sorry, can you repeat the question again?
Oh,
Apologies.
sure. My open enrollment form switches my family, me and my spouse, on Medicare and dependent out-of-state son to Blue Shield MAPPO. Do we have other choices?
Oh, that's right. So I did have that one answered in the chat. So if you are out of state, the only plan that's going to be available to you is the Blue Shield PPO plan. If you are if you are at any point within the state, you'll have the opportunity to enroll in Kaiser as well as a Medicare retiree, but as a Medicare retiree out of state, Blue Shield PPO is the only available option to you and to your dependent as well.
Okay.
So I think my answer was a little bit more eloquent in the chat.
To check the chat as well. Okay, and then Colleen asked, if non-Blue Shield plan in 2025 and then become Medicare eligible in December of 2025, will there be an open enrollment before December 2025 to get into a Blue Shield plan by 12/1?
Yes. So the way that that would work for you is that if you are currently a non-Medicare retiree, you can be enrolled in any of our non-Medicare retiree plans. And as you are getting closer to turning 65, we of course will have an open enrollment next year. For plan year 2026. And so you can make changes at that time for plan year 2026. However, if you're turning 65 in December, we're going to actually switch you over prior to any of your elections for plan year 2026, because we will need to enroll you in a Medicare plan in December of 2025 if that's the month that you're turning 65.
Thank you.
I was just going to add that Medicare information will have to be provided to us prior to your month when you turn 65 in order to avoid being enrolled in the penalty plan.
Thank you for that. And then Claire wants to know, she currently lives in Maine. Does Blue Shield MAPPO provide all the same benefits as Blue Shield California?
Yes, this is the nationwide plan. So absolutely all the benefits and services that you have in California can be accessed outside of California within the US. And once again, you have the Blue Cross Blue Shield providers in network, and then you've got the other Medicare participating providers, not contracted with Blue Shield, but as long as they participate in Medicare and bill Blue Shield, those services will be covered. And all at the same cost share too as well. So in network, out of network. So those are great features of the plan.
Great, and I think this question probably already came up earlier, but our members can go to Walgreens pharmacy. They just won't be able to get the 3 months for the price of 2, correct?
Correct. They are part of the pharmacy network, our pharmacy network, but just not part of the preferred network that does have that 2 for 3 cost share.
Okay, and Tim has follow-up. What other countries can access Blue Shield services? So I think this might be a dual question. So if you actually reside outside of the United States, the Medicare plan is probably not the best plan for you. If you just travel a lot, but your home residence is inside the United States, all of your emergency, and Charles can go into it, your emergency and urgent care will be covered, but you have to pay first and you'll get reimbursed. You have to fill out some forms. But if you reside in another country and you want to have HSS medical benefits, you can use the Blue Shield non-Medicare PPO plan. And then you'll basically be paying, I believe, out of network rates and get reimbursed, including for your routine medical services. And then how do I access, so Patricia wants to know, how do I access Medicare options with this Blue Shield plan? Charles, you want to, I think you can
Medicare
go to the same
options.
doctors that you already
Oh,
have.
okay. Right. So yes, well, that's one of the great features of this plan. We've got, as I was explaining earlier, you've got in-network Blue Shield doctors and out-of-network doctors as well. So as you can use your Blue Shield doctors easily enough, they recognize the plan, they understand the plan, they contract with us, so that should be seamless. For out-of-network doctors that we don't have a contract with, as long as they bill Blue Shield, your coverage will be maintained and you can see your doctors. So
Thank you. And Claire just wants to confirm, if I'm not making any changes to plans listed on the open enrollment statement, do I still have to enroll online at eBenefits? Olga?
So if you are not making any changes to any of your other plans, there's no additional action that needs to be taken. So for anyone who is transitioning from the UHC MAPD PPO plans to the Blue Shield MAPD PPO plans, that process is going to be automated and there's no additional action that you'll need to take. The only thing you're going to want to consider is whether you want to keep your dental and vision plans as they are. And if you do, no additional action is necessary.
Thanks. And Margaret wants to know, do I have medical coverage traveling outside of the United States? Charles?
so yes, you have urgent and emergency care available to you. So
And Claudia wants to ask, is Safeway Pharmacy okay? Is that considered preferred or not?
I think
Safeway?
Safeway is preferred, correct. So
Okay, so Safeway is in network.
Safeway, Vons, and Ralph's. So yes.
Okay, and preferred means you can, if for those maintenance medications, you can get
Right.
3 months supply or 100 days for the price
100
of
days,
2.
actually. Yeah, that's a great point. Yeah, 100 days, technically. You want to make sure you've got that extra 10-day of coverage just in case you're in between refills. So, yes, you've got Safeway for that 2-month copay for the 100-day supply. Yeah.
Okay, great. And Irene, Irene, this is a great question. So what happens to reimbursement claims still at United Healthcare? Will they be completed at UHC or transferred to Blue Shield?
So, Jessica, that depends, and Irene, that depends on the date of service of those claims. So, if they're 2024 claims in 2024, United will process those as appropriate. If they're post 1/1 in 2025, those would need to come to us, and we would take care of those reimbursements. So,
Thank you. And then I've got another follow-up. So there's a possibility that a Kaiser doctor will also accept a patient who is with Blue Shield as long as the patient has Medicare benefit.
Technically, that is possible because they are, Medicare participating providers. But the challenge may be to see if they will bill Blue Shield. So typically, Kaiser doctors, they're Kaiser for a reason. And so it would be up to the provider to see if they would, as long as they're willing to bill Blue Shield for those services, they will be covered, absolutely. But because they're in the Kaiser ecosphere, sometimes they don't want to travel outside of that. So you need to talk to your Kaiser provider first, I think, before seeking coverage post 1/1, I guess would be my recommendation.
Yeah. Do you have any instance of this occurring? Blue
That's
Shield Medicare member?
that's actually a first. That's actually a unique question. I can check back in with our folks internally as well to see if that's happened historically. But typically, folks kind of either stay Kaiser or stay Blue Shield. They don't intermingle too much. But that's certainly something that we can look into, Jessica, and share with folks afterwards. Interesting though. Getting creative. That's definitely true.
Yeah. Yes, make sure you do your research before, and you only have until this Friday, so we 2 more days left. So we know this is a big decision.
Right.
So call the doctors up and understand that before you make an election. And then, does Silver Sneakers cover full cost of coverage at any YMCA anywhere in the US?
So I think I put in there once again the link for Silver Sneakers gyms so that you can look up, or you can give us a call and we can confirm which gyms do participate. So there are various YMCA gyms nationwide outside of the city ones that I know are contracted, but it depends. So unfortunately, you have to call in to get that information confirmed or check online.
Great. And Tim, okay, and I totally understand why this is confusing. So just to confirm, if I live outside of the United States, I don't need to enroll in Medicare. That is correct. But how do I enroll in Blue Shield PPO once I return to the States, and will I be penalized by Medicare for being late enrollment because of over age 65? Olga, do you want to take this?
So we can't really give advice on Social Security Administration rules for Medicare enrollment, but I did put in a link to the Medicare.org, I think, site that talks about enrollment that for members who are outside of the United States and how you could get support with enrollment after you return. So you're going to want to check out that link and connect with Social Security. But I do believe there would be a waiver if you are a full-time resident outside of the United States. Don't quote me on that. That would be something that you want to connect with Social Security on. But what will happen with in terms of our coverage, because we do require Medicare enrollment for those who are eligible. If you are not eligible or not required to enroll with Social Security because you're not eligible as an outside of the United States resident, you would provide us with a disposition statement from Social Security stating that you're not eligible for Medicare because you're not living in the United States, or whatever the reason for ineligibility would be, and then we would waive that. But otherwise, overall, the general rule is that you are required to apply for Medicare, premium free Part A, and premium Part B if you are eligible for those Medicare elements.
Thank you. So yeah, please make sure you call the Social Security Administration to discuss your options. And I believe in addition to just getting that waiver for living outside of the US, you would also have to prove that you were continuously enrolled in some sort of health coverage, even if it was local to that country. But consult Social Security to make sure. So Claudia has a question for you, Charles. Is UCSF in network or out of network?
Yes, UCSF is in network. Although I just want to, once again, even if they were out of network, as long as they're Medicare participating in Bill Blue Shield, your services would be covered. So, but today they are in network. So absolutely.
Okay. And then Alice has a hypothetical question. If one lives outside of US for a period of time and returns periodically to the US, must one continue Medicare coverage?
So I think it's the same as the previous previous answer, is that that will all depend on the eligibility for Medicare under Social Security. And so you're going to want to see how much time outside of the United States means that you don't have to apply. So that's something that you're going to want to connect with Social Security on.
And then is Peace Health in network? I haven't heard of this, Charles.
Yeah,
Peace Health.
so I'm not familiar with that as well. So I suggested that Gail give us a call and we can take a look directly. And if needed, if Peace Health is currently your current provider, we can give them a call. And if they're not in network, we can give them a call and educate them on the plan. Once again, 100% fee for service reimbursement, and typically they will continue to see you. So,
If they're participating in Medicare.
oh yes, and that too. I'm assuming that they currently are as well. Yes, absolutely.
And Claudia wants to know how to find out who is in the Blue Shield network. Could you share the website and the phone number?
Sure, I did. I think I
Oh,
can do it
great.
again.
I see that.
But
Yes.
you've got the website, and the phone number is 800-370-8852, 800-370-8852, 8 to 8, 7 days a week, Pacific time. And once again, it's not your typical, it's a dedicated member services number for HSS. So you won't have a lot of, phone trees to go through. We'll typically answer the call in less than 30 seconds, less than a commercial. I think we're at like 8 to 9 seconds right now. So you should be able to get to folks pretty quickly, and they'll stay on the line to help you with your questions as needed. So.
Great. And Margaret currently has Blue Shield Access Plus HMO right now. Should I change Blue Shield Access Plus PPO? Should I change to PPO if I plan to retire before June 2025? Olga?
You don't have to change. You can if you'd like to, but you don't have to change to a different plan as an active employee to have that transition over. If you're going to be under 65 when you actually retire, you'll still have access to the Access Plus plan as long as you're living within the Access Plus area. And you will still be required to enroll as a retiree with the health service system. The transition will not be automatic for you. Unfortunately, because we have a variety of different plans, we don't want to just stick someone into an available plan and then have that as the plan that they're going to be in with for their retiree plan. So you'll still have to you'll still have an opportunity to enroll in a retiree plan once you are getting closer to that retirement age.
Thank you, Olga. And so Walter wants to know, why did they change and how can we find out if our PCP is on there? So Walter, as far as why we changed, our mission at the San Francisco Health Service System is always to find affordable and sustainable care for our members. So from time to time, we go out to bid to make sure that we are getting our members the best rates possible and to make sure that we can sustain our coverage for all of our members. We do this before, there's already been a trend in healthcare of the growing cost. And so we wanted to get in front of that and see, ensure that we are able to maintain our rich benefits and keep our plan design the same. As far as checking to see if your current PCP participates with Blue Shield, I think Charles can help you with that.
Correct. So Jessica, members can obviously call us once again at 800-370-8852, and we can help you locate your provider or give them a call if necessary. So absolutely.
Great. And Kevin has a great question. Is concierge medical covered? My primary doctor is not using insurance, so does not accept any insurance. Is there reimbursement available?
Yes. So what we can do is we can give them a call and help them understand, once again, how the plan works, how we aren't trying to contract with them and pay them less than Medicare rates. As long as we typically share with them that and they are accepting of Medicare rates and willing to bill Blue Shield, you will be covered in that scenario.
So they don't have to be Medicare participating either,
Oh,
as long
I'm
as
sorry.
they take the
I'm sorry.
Medicare rate. Is that correct?
Yeah, I'm sorry. Thank you for that clarification. They do have to be Medicare participating and bill Blue Shield. So those two requirements are still there. But typically, even concierge providers typically are Medicare participating. Not all, of course, but they are. And so it's up to them. Ultimately, because they're not contracted, it's up to them to decide for their practice what is best. And so our job is to help educate the members, you, and then also educate the providers so that everyone has the information to make the best decision for their practice.
Thank you. And then Robin wants to know, to be clear, the choice is Blue Shield, Medicare, or other plans. You can't have both Medicare and Blue Shield coverage. Is that correct?
Correct. You can't have double coverage, in other words. Because as we mentioned before, Blue Shield is becoming primary, that is your only coverage. If you I'd like to, I guess we'll take a couple seconds here. If you become very popular this time of year and you sign up with another plan outside of these HSS plans, you automatically will be bumped off, unfortunately, of your HSS/Blue Shield coverage. And so you'll lose also the other benefits with HSS. So before making any decisions during open enrollment type of timing, please, reach out to HSS and reach out to Blue Shield and understand the coverages and potentially the disruption that will occur. And once again, yes, you can only have one coverage, one plan coverage. You can't be double dipping, unfortunately. So.
Yeah. And we do understand that for many of our retirees, you're getting bombarded with advertisements and it sounds
Absolutely.
great. Like, oh my gosh, you're going to have all this benefit, especially for the pharmacy
Right.
benefit. You
Right.
already have pharmacy benefit with the HSS Medicare
Exactly.
plans, all of them, including the Kaiser Senior Advantage.
Right.
If you sign up for any other coverage, even though they say they're Part D only or whatever it is, it will automatically kick you out of our plan.
Right.
And then you'll have to wait for the next open enrollment to re-enroll. So please consider all,
yes.
Do your research and make sure that
Correct.
that's what you want before you move forward.
Right. One last thing I just want to point out to folks is, as you were mentioning, Jessica, the pharmacy aspect of it. I can guarantee you all those street plans, their formulary is not as rich as HSS's formulary, either with Kaiser or with Blue Shield. The formularies, the benefits are very rich and custom to what HSS is used to providing, the level of service, the level of care, the level of benefits. And that's the hidden aspect of it for those street plans that they tell you, hey, you can get $0 generics, et cetera, et cetera. But the question is for those, the additional formulary aspects, the specialty drugs, will those be covered? And I can almost guarantee you that those street plans will not be as rich as the HSS plans. So please, as Jessica mentioned, do your research. Give us a call. It's as simple as giving us a call to be able to understand the differences and help you make an educated decision at the end.
Great. And Marlene, we will be posting this video. It does take some time. So we will be posting this video later this afternoon, and you can find it on our open enrollment calendar. I know Olga's already shared that link in the chat. Kevin wants to know, as retiring in Texas with my dental exhausted, understand that if I hit in mouth, breaking 2 teeth and cracking a third, is very specific. Does Medicare cover that, and how to handle getting it repaired?
So yes, in that case, it's not a routine dental service. So you can go to a dentist and it will be covered under your Medicare. They will bill Medicare as opposed to your Delta Dental. It'll be covered under a Medicare service. That sounds very painful. Hopefully that doesn't happen. But yes, for Medicare covered emergencies or coverage like that, it will be covered as opposed to the routine dental, the cleanings, the crowns, et cetera, et cetera. So,
Yeah,
that sounded really painful.
Yeah, it does. So if that means that you would go to ER,
Yes,
not
yes.
to a
Yes,
dentist,
sorry,
but to
yes.
go to an emergency room. So you don't go
Right.
to your regular dentist for
Yes,
this
I don't.
service.
Yeah, I don't think they would be able to timely. Yes, emergency room would be the right choice. Yes, thank you.
And that is the only way to get it covered by Medicare,
I
because they can't just walk into their dental office for this.
I would ideally say yes. That's correct. So.
Okay, and then I've got another follow-up question about options for son out of state. Spouse and I are on Medicare. We responded that we could opt for a Blue Shield non-Medicare PPO plan for out of state non-Medicare dependent. Are there 3 choices for our son then? No, so both the Trio HMO, all of the HMO plans your son who is out of state would not qualify because the HMO plans are for inside California only. So that's why you only have the option of the PPO. And then Linda wants to know, is Sutter Health in network?
Yes, Sutter Health is in network.
And hi, Jessica, is it possible to reach you for a couple extra questions related to enrollment? If this is about the Kaiser to Blue Shield transition, the Blue Shield member services, which Charles has mentioned already, answers their calls within like less than 10 seconds. They're probably your best bet to ask about transitioning your care from another provider like Kaiser to Blue Shield. They'll know more than I do. And then what does BSE stand for? Oh, yes, Blue Shield of California.
I
But
apologize
it
for
is a
using
national
acronyms.
plan. Yeah, I'm sorry about
Sorry
that.
about that. Yes, I'm sorry. To shorten my responses, I apologize for that.
And where can I read about Blue Shield plan covers and how to use it? Oh, okay, so the explanation of, not explanation of benefits, the evidence of
Evidence of
coverage.
coverage, correct. So you can, I put the link online as well, or you can go to blueshieldca.com/SFHSS, and that gives you the website to be able to access that online. Or you can give us a call, once again, 800-370-8852, and we can mail you the materials as well. So you can get it, through the mail.
Okay, and I think we're almost down to the final question. Can I enroll a spouse in vision or dental if they are not enrolled in my medical plan? Olga?
Yeah, so but you do need to be enrolled in the plans as well. So if you'd like to enroll your spouse in dental, you can enroll them separately just in the dental plan as long as you're also enrolled. Where you won't be able to make that distinction is with our vision plan. Vision comes along with our medical plans, and so enrollment in a medical plans automatically gives you access to our basic vision plan. You can buy up into the Vision Premier, but you won't be able to separate those out. So if you're looking only for the vision plan for your spouse, you won't be able to do that independently with us.
Okay, great. And then Tim has a follow-up. And Tim, I think for your specific situation, you'll have to call the Social Security Administration to get that clarified. So if I waive medical coverage starting next year, since I currently have probably not Medicare, but medical coverage in the country you live in, will I be able to enroll in Blue Shield PPO?
You need
Can
to
they have
have
the local medical, well, the non-Medicare PPO, you can enroll in that. And I suppose they can also enroll in a local health plan for the country they're living in. Olga, is that correct?
If it has to do with Social Security rules, we won't be able to completely answer that. I think it goes a little bit beyond the scope. We can really kind of just focus on what they would be able to enroll in with us once they figure out what their enrollment requirements are to avoid the Part B late enrollment penalty or being dropped off of Part B.
Mhm.
But if they're Medicare eligible, they live full time outside of the country, they would be, and they want to enroll with us, they would have the non-Medicare option available to them. But anything around any sort of penalties with Social Security, you'd have to find out from Social Security.
Yeah. So we highly recommend you call Social Security and explain the situation. And then final question, can we request Blue Shield PPO coverage booklet? Absolutely. So I know Charles just put that in
yes,
the chat. You can
right.
call to get that. You can also get it. So I believe it's the evidence of coverage is the detail of everything that
Yes,
is
exactly.
covered.
Absolutely. So evidence of coverage is our contract with you as the member to all the plan benefits. So you can get that to read and to reference. And then once again, you can also, if you have questions after you get that, then you can call in and clarify. So that's a great way too as well.
And I just added the link to the
Perfect.
plan documents off of the Blue Shield website for SFHSS.
Thanks,
Thank you,
Olga.
Olga. So I want to thank all of the presenters for staying 19 minutes after the webinar has ended, because we really want to answer everyone's questions. We know there's only 2 more days left to make your elections. So please get your elections. If you have changes, if no changes to make, then you do not need to do anything. And so thank you all for attending to learn more about your benefits. And thank you, everyone. And with that, I'm going to end this webinar.
Thank you, everyone. Be safe.